It's no different from physicians or any other healthcare provider. I would say at an individual level, each physician assistant or any other healthcare provider should probably aim at staying up to date, at maybe reflecting on their workday and figuring out if there was a situation that was a close call or near miss, how it can be prevented in the future. Being a good team player is critical for physician assistants particularly, and always not being frightened to solicit another opinion, verify the diagnosis or whatever action that FVP is getting ready to take. There are measures that are taken at individual facilities level, and those are protocols that are in place in emergency departments, on medical floors, in the pharmacies, and those are definitely very helpful to eliminate errors. And then on the national scale, we don't have a very good effort, as I had mentioned before, but there are some efforts to encourage facilities to report medical errors and do root cause analysis to avoid those in the future.
Okay.
I think it's getting worse. I think healthcare is becoming more and more complex. There are so many participants and so many different parts in healthcare where a simple step like medication administration would involve multiple participants, and majority are humans, and humans are susceptible to errors, so it really is inevitable. Errors are inevitable. It is really more that we have to work towards creating environments that would make errors very difficult to happen in workplaces to save patients' lives. I would say hospitals are dangerous places. Stay healthy and avoid hospitals and avoid doctors' offices. But if you can't help it and you end up in a hospital, be a very active participant of your healthcare, and don't hesitate to ask questions and verify what medication is being administered, how it was ordered, why it's being administered. These are just examples of how patients should really scrutinize what is being done to them, because they end up being victims of incompetencies or just system failures.